So the first question is supernumerary tooth. What are supernumerary tooth? They are the extra teeth in your dentition, right? The second point is they may resemble normal teeth, and the next point is distomolars generally they don't resemble any other tooth. So what are distomolars? They are the supernumerary tooth located distal to the third molar. Okay, they are called as distomolars. And mesiodens is the most common supernumerary tooth. So the supernumerary tooth they may resemble normal tooth. The distomolars they don't resemble any other tooth. They are the tooth present distal to the third molar, and mesiodens is the most common supernumerary tooth. So what is mesiodens? Mesiodens is a supernumerary tooth present in the midline between two central incisors, and mesiodens may cause cyst formation, malocclusion, or food impaction. Okay. So the next question is, in which condition, which dental anomaly actually can you see there is an associated disease of defective bone in the body? So mostly it is dentinogenesis imperfecta, because in dentinogenesis imperfecta type 1 it is generally associated with osteogenesis imperfecta. So there is a defect in dentin as well as defect in bone. Okay, so the answer will be dentinogenesis imperfecta. It is generally associated with defective bone formation in osteogenesis imperfecta. Okay, so you can correlate dentinogenesis and osteogenesis imperfecta together. Okay, so the next question is, fusion of teeth is more common in? The answer is primary dentition. So mostly when you see there is a fusion of teeth, that is two teeth they fuse to become one. Okay, so this condition is most common in primary teeth but not as much seen in permanent dentition. Okay, all right. So the next question is Gardner syndrome. We have discussed this in the previous video also. Gardner syndrome, it has multiple osteomas, multiple polyposis, supernumerary teeth. Okay. Okay, so the next question is, prolonged administration of broad spectrum antibiotics results in the formation of black hairy tongue. Okay, so what happens if a person is given a broad spectrum antibiotics but for a long period of time due to some reason, so the side effect is that he will get black hairy tongue. Okay, yeah. So the next question is hairy tongue. What do you see in hairy tongue? There is generally hypertrophy of filiform papillae. Okay, filiform papillae they get hypertrophied. It is called as hairy tongue. All right. Okay. Okay. So the next question is, a child comes to your clinic. He's just 4 years old, and when you check his oral cavity, there are less number of teeth. Okay, and on X-ray you can see that there is bifurcated root of the lateral incisor with two root canals. So how is that possible? So the answer will be there is fusion of teeth. Because of the two teeth they have fused together, so they look like one teeth. So the number of teeth in oral cavity will be lesser, but the root the X-ray shows two roots plus two canals of the lateral incisors, which indicates that two teeth have fused into one teeth. Okay, so it is fusion of teeth. Okay, so the next question is nasolabial cyst. So what is the origin of nasolabial cyst? It arises from the remnants of cell rest of embryonic lacrimal duct. So the nasolabial cyst, it arises from the remnants of cell rest of embryonic lacrimal duct. Okay. Microdontia, the next question. The microdontia is small size of tooth. So it most commonly affects maxillary lateral incisors. Okay. All right, so the next question is taurodontism. What is taurodontism? Taurodontism is elongated wide pulp chamber of tooth and short roots. Okay, so when you see the x-ray, you will see that the pulp chamber is quite long, and the tooth, if you compare, it is shorter than the normal. The root size will be shorter. Okay, the roots will be shorter and the pulp chamber will be longer. That is taurodontism. Okay, the next question is mottled enamel. So what is the cause of mottled enamel? It is due to excess of fluoride. Okay, so excess of fluoride in your water, uh, it will result in mottled enamel. Okay.